Hi, in this video we'll analyze a case of an athlete suffering from plantar fasciitis. This is a very interesting case where an athlete, a kickboxer in fact, who weighed about 115 kilos, injured his knee, and after recovering from his injury, which took him almost 6 months, where he couldn't do any sports, when he started training again, running and skipping rope, he developed plantar fasciitis on his left side. So this was a male patient, age 28, and as I told you, he weighed about 115 kilograms. When the patient came to my clinic, he was already doing physiotherapy, both for the knee and for his plantar fasciitis, but he was still in a lot of pain. He couldn't walk barefoot or even put his bare feet or even put his bare left foot on the ground without excruciating pain, and even with running shoes on, which were very supportive, he could not walk without limping because he was in a lot of pain. If you'd like to learn more about the techniques that I talk about in my videos, check the link in the description where you can see the full course that I have available online. As I told you, this was his left foot, and as most of you probably know, treating plantar fasciitis or anything in the sole of the foot with acupuncture is sometimes a bit tricky, even if you use more advanced techniques such as the Balance Method or Mastodon acupuncture. And one of the main problems is that you don't have a lot of points of reference in the sole of the foot. You only have one classical point, which is kidney 1, and then you have the kidney channel going like this. So if you want to do a classical balance method application where you go for affected channel, balancing channel, it's very hard to do unless the pain is exactly on top of kidney 1. In this case, the patient complained about pain all along the border of his heel, and it radiated a bit towards the middle of the foot, like this. In cases like this, I like to use a technique called direct equivalency. This is an image or a mirror that is so perfect, the anatomy is so close that you don't need to bother yourself with which channels go there. You can just do a direct equivalency between the two structures. And for the foot, obviously, you can use the hand. They are so similar that if you puncture an area that is a reference to the other one, you don't need to bother yourself with which channels go where. There is some discussion amongst different authors if you should puncture on the same side or opposite side. I've used it both ways according to different teachings, and you get results with both of them. Today what I do is I palpate both sides, and generally I will use the side with more acupoints or where the acupoints are more sensitive. In this case I ended up using the opposite side hand, so the right hand, and what I did was exactly that technique that I talked about. So if this represents more or less the line of the heel, if you imagine the hand representing the foot, so I palpated all this area for acupoints going a bit towards the center of the hand to emulate the radiation to the center of the foot. And I found about 6 acupoints. I needled all the acupoints I could find, and I asked the patient to try. He was bare feet, so I asked him first just to stand. While standing, the patient told me there was no longer really pain, it was more of a discomfort. I asked for him to walk a couple of steps, and he told me that the pain was still there, but much less, about 2 or 3 out of 10. I decided to add the YNSA point for the foot. which you typically use on the same side, so I applied it on the left. And I asked again for the patient to try the first standing and then walking. Now standing there was absolutely no pain and no discomfort, and while walking he felt a bit of discomfort but no pain. We repeated this treatment twice a week for 3 weeks, so 6 treatments, while he was also doing physiotherapy. And after 6 weeks, since the pain was no longer coming back between sessions, we did a session after 1 week, so in the 7th session there was still no more symptoms, so we stopped the treatment and the patient could go back to his sports and train again at full blast. Thanks for watching the video. Don't forget to like and subscribe. There are lots of different videos on different clinical cases in my channel. Also, if you have questions, suggestions for the videos, leave them in the comments.